Welcome back to Toledo Clinic TV. My guest for this segment is Dr. Robert Hartwig, and he is an orthopedic surgeon. And we want to take a few minutes just to get to know you, doctor. How long have you been practicing medicine?
Practicing medicine since 1974. I graduated from medical school. I've been practicing in Toledo for over 37 years.
What got you interested in orthopedics?
During medical school, during my third year, we take a rotation, and it was very anatomical, which I enjoyed. Surgery was very interesting, and what got me interested in hand surgery as a segment of orthopedic surgery was one of my mentors. I trained at the University of Michigan, was very young, very good in teaching, and took an interest, and I think that was probably the main driving force.
And what brought you back to Toledo?
My wife and I grew up in the area.
Okay. And tell me about your experience with the Toledo Clinic.
Been very good. We've been members of the Toledo Clinic now for a little over 6 years, my partner and I. It has afforded us opportunities that other venues in the community no longer did, and has excellent facilities, particularly the ability to refer among physicians there. The communication, I think in this day and age, it's important. Also the physical plant, it has an excellent outpatient surgery center on the campus, and accessibility. And the patients know. I mean, it's been around for a long time, and it's easy to direct patients there. And with other satellite facilities, that also is certainly an advantage. But mainly, I think, having the surgery center, diagnostic capabilities, all in one setting.
So what are the benefits for patients to come to the Toledo Clinic compared to other facilities in the area?
Well, I think it's accessibility. The location, the fact that the facilities are state-of-the-art in terms for a surgical center, and the ease of referral among physicians. Toledo Clinic, realistically tends to take care of their own, and the staff there are very accessible. If you have a problem, you can get your patients in to see another physician, and I think it's just a very streamlined operation. And within the confines of the clinic itself, there's a pharmacy, there's radiology, and the electrodiagnostic studies can be obtained there, as well as surgical treatment for it.
You've been doing it a long time, and you're obviously very passionate. What is the best part about being a physician?
Well, I think the ability to, particularly from my standpoint, define a problem, treat the problem, and have the patient leave satisfied, and have it done in as, less hassle-laden and less tedious compared to other venues. And, realistically, there are barriers today that didn't exist when I started in practice, and I'm sure you've heard that before. Being in this situation minimizes those barriers. It allows you to focus on practicing and dealing with patients, which is actually what you were trained to do.
Sure. All right. Thank you, Dr. Robert Hartwig. We appreciate that. We'll be right back.